Coming to sinusitis, it is an infection caused to the sinuses. Sinuses are of four types: frontal, ethmoid, maxillary, and sphenoid. And sinusitis, it is acute type and chronic type. Coming to the acute type, etiology, it is divided into three causes: exciting, predisposing causes, and general causes. Exciting causes, sinusitis is due to infection. Remember this. S for swimming, I for infections, D for dental infections, and T for trauma. And predisposing causes are obstruction to the sinus drainage, to the normal sinus drainage. It is due to nasal polyps or DNS, deviated nasal septum, or else edema of sinus ostia or hypertrophic turbinates. And next comes stasis of the secretions. Stasis is normal secretions do not drain into the nose. It is due to the increased viscosity or obstructions like adenoids. Then previous attacks of the sinusitis. Due to previous attacks of the sinusitis, the local defense mechanism of the pathology, there is inflammation of the mucosa due to all these causes. As a result, hyperemia occurs in the mucosa and exudation of the fluid and polymorphonucleosides, and there is increased activity of serous and mucous glands. Inflammation, hyperemia, and increased activity of serous and mucous glands. Coming to the clinical features. Clinical features are headache. Headache is seen in maxillary and frontal sinusitis. In frontal sinusitis, it is office headache. It is called office headache because it reaches to the peak in the midday from the morning. So it mostly seen in office hours, so it is called as office headache. And upper eyelid swelling in frontal, because frontal is related to upper eyelid. So it is upper eyelid swelling in frontal. Lower eyelid swelling in maxillary, because maxillary is related to lower eyelid swelling in maxillary, and both eyelids are swollen in ethmoidal. It is due to ethmoid lies in the medial aspect of the eye. Coming to nasal discharge. Nasal discharge, it is seen in maxillary, frontal, and ethmoid. In the medial meatus, ethmoid may be seen above the medial meatus due to opening of the posterior ethmoidal sinus. Anterior ethmoidal sinus opens into medial meatus, whereas posterior ethmoidal sinuses open in the superior meatus. Postnasal discharge, it is seen in the soft palate in maxillary and nasopharyngeal posterior wall in sphenoid. Other feature of the sphenoid is headache in the occipit region. Treatment is by medical or surgical. Medical treatment, antibiotics like amoxicillin, ampicillin, and nasal decongestant drops, steam inhalation, hot fermentation, and analgesics. Steam inhalation loosens the secretions and it helps in and it encourages drainage. Then comes surgical. For maxillary, antral lavage, it is approached to the inferior meatus, and trephination of the frontal sinus. Trephination of the frontal sinus is incision. Horizontal incision is given in the superior medial aspect of the eye, and a hole is drilled and the pus taken for culture and the sinus irrigated till frontonasal duct becomes patent by inserting a plastic tube. For ethmoidal, external ethmoidectomy. For sphenoid, also external ethmoidectomy. So it's called as external frontoethmosphenoidectomy, as through this approach, frontal sinus, ethmoidal sinus, and sphenoid sinus can also be approached.